We do a lot of things, and we all work, and this is sort of our side thing. And there's so many more opportunities that come our way to do more things, and we struggle to find enough human resources to be able to do it. So we decided we needed to sort of, and actually this was Samantha's idea, brilliant person there, to basically sort of create sort of a volunteer corps, and she is the coordinator. So to the extent that you're interested in getting more involved with us, please do talk with her afterwards. All right, so without further ado, we are going to get on to our main event here. As I said, the focal point of this is finding treatment, sort of another name for it is sort of navigating your way through the treatment system. So we have individuals here who are involved in helping people find treatment in different ways. I am going to do a very brief introduction. You can see all their names here on the little tents in front of them. I'm just going to give you a like job title with the name, and if I get it wrong, please forgive me, guys, and correct me or add to it when it's your turn to speak. So I'm going to do that little introduction, and then I'm going to let each of them sort of take the floor and tell you a little bit about what they do. And then we'll open it up to whatever questions you might have. I've got a few prepackaged questions in case you guys aren't real quick to jump to the questioning. But this is really for you, so don't hesitate to ask questions if you have them. So to my immediate right here is Lisa Bosca. She is our fan person, and in particular, she runs the Hope Not Handcuffs program that Families Against Narcotics started in February 2017, I believe. So she's going to tell you some more about that. And then to her right is Chris Odrowski, and Chris and I go way back. We used to be involved with a different addiction treatment organization. I was on the board, you were employed by them. Great organization, but we all moved on to different things, right? He is now working with Hagera Programs, and he's a peer recovery coach. And then to his right is the lovely Darlene Owens. Darlene is the Director of Substance Use Disorder Services for the Detroit Wayne Mental Health Authority. Next to her is Pat Stropes, and so Pat Stropes is with GrowthWorks. He is a peer recovery coach, but even more than that, he's essentially managing the Western Wayne Rescue Recovery Program, so he's going to tell you about that. And then finally, last but not least, is Tim Tout, who is a peer recovery coach working with the 29th District Mental Health Court. And so he's going to share with you the work that he does, and I believe you're also doing some work with Wayne County Jail that I'd love for you to share information with us as well. So without further ado, I'm going to let Lisa take it away. Never mind.
Okay, can you hear me okay?
Yeah.
Okay. First, I just want to introduce myself. My name is Lisa. I am a family in recovery, and what that means is I have 3 children, and 2 struggled with substance use disorder, and they are both now in recovery. It was a long, long road. A short little introduction. I became involved in FAN about 4.5, 5 years ago. I walked into my first meeting not knowing nothing. And here I am now the regional coordinator for a program called Hope Not Handcuffs. FAN is an amazing organization. So with that being said, Hope Not Handcuffs is an initiative that started with FAN February 1st, 2017. And what that means is anybody that is struggling with substance use disorder, even alcohol, can walk into any of the participating police stations, which is 72 stations right now. Ask for help, just say they're there for Hope Not Handcuffs. They call the coordinator, and then we dispatch a volunteer angel, and right now I have almost 800 people trained. We are in 7 different counties. We are now in 6 different hospitals where we send people to the hospital. We have processes besides going to the police station. They can do an online assessment, but we're still trying to break that stigma so they can walk into a police station so they're not scared. We took a little survey and we found that people that are suffering would rather walk into a police station than go to a hospital. Yeah. My kids would have argued with me on that. But It is true, because once they walk into that station, they're ready. They have surrendered and they're ready for treatment. So that's why it's so imperative that we get our angel volunteers out there to help them get into treatment. And the angels, the only qualifications is just compassion and no judgment. We help them fill out some paperwork. We call their county access department, and off to treatment we go. We have 2 different ambulance services in Macomb County that help us with transportation. We utilize Uber Health, so if they have nobody, we can transport them. Since we've launched February 1st, we've placed over 3,200 people. Yeah, it's amazing. So once we get them into treatment, a lot of times we have people that have been on the streets for weeks and weeks, with no family, no nothing. So we have what we call police bins at each of the police stations, and in those bins we have multiple things for them. We have some hygiene products. You figure if they've been on the street, they don't have anything. We have some food there, we have hard candy, we have water, we have blankets, we have socks, we have hats, gloves in the winter months. All the necessities, the basic necessities I should say, to at least make them comfortable while we get them into treatment. Another program that FAN is starting is called the Family Recovery Coach. Because we figure once we get loved ones into treatment, that family needs to start recovering too. I became a certified family recovery coach and an interventionalist 2 years ago. It's a hard job to do, to say the least, because a lot of families, like I was 5 years ago, they don't know nothing. And sometimes families can hurt their kids more than help them. So that's another service that FAN is offering. Any questions?
I have one.
Yes.
Ah. It's not working. All right, I'll say it really loudly, and then I'll figure this out while Chris is talking. So there may be people in this room who want to be angels. Could you talk a little bit more about that process, what the angel does, how they would get trained to be an angel?
Absolutely.
Yeah.
So, like I said, we have quite a few angels trained, but it's still not enough. I need people that will go into the police department and help them. It's a 2-hour training that I have, and the first hour of the training actually is Narcan training. After that, it's about an hour training. It teaches you the paperwork that we need to fill out, and then you get a step-by-step protocol. It's very, very simple. If you follow this guideline, you can place somebody 99% of the time. Also, the whole process of being an angel, from the time you get to the police station, from the time they leave, could vary anywhere from 45 minutes to an hour and a half, just depending on what the person is struggling with, what type of treatment they need, because not all facilities can detox for different things. So if you want to be an angel, please see me. I have flyers back there too. We need some here. Yes, sir.
Lisa, what is the time commitment for an angel?
It is 2 4-hour shifts a month, or as much as you can give. So not a lot. We need lots of angels here. Yes?
How would someone get support from their family recovery program?
How does someone, I'm sorry?
How do they get involved or get support if they need it?
If they need it, they can go actually to the FAN website. We are in the process of building an application for that. But until then, you can contact me. And I'll leave some cards here at the table too.
For the family recovery?
For family recovery, yes. Yes.
Is there a cost?
No, there is no cost. We will put you through the CCAR training, and I will be doing a parent class training for 6 hours, and with the possibility of being hired with Families Against Narcotics.
I mean, if somebody needed support, not that they wanted to be in the recovery.
It's a service that FAN is providing at no cost to families
Okay.
for 12 weeks.
For how many?
12 weeks.
That's amazing.
Mhm.
Thank you.
You're welcome.
Family support you're talking about?
I'm sorry?
The program you're talking about,
Mhm.
family support, the one where it's a many person phone call?
It's a what, I'm sorry?
The many person phone call people and their family or support.
Right, if family members have a loved one that is struggling with addiction, sometimes it helps the families to get healthy in order to help their loved ones. So this is a program that's gonna help the families establish some healthy boundaries.
Right. Wonderful, thank you.
You're welcome. Yes.
Lisa, can you talk a little bit about how you track the success of the program?
Yes, so we have a data analyst for the program. Since we were allotted a large money by Michigan State Police as our fiduciaries, and so we're data driven now. So we have support staff that follows up on these participants that come through our program. They do a 48-hour call to make sure that they're still in their detox facility. After that, they do a 2-week follow-up call, a 30-day, a 60-day, and a 90-day. Sometimes we find when we're following up with them, like after 2 weeks, they got scared and they left treatment. So that gives us the opportunity to get them right back into treatment again. So we have successfully, I don't want to say how many we have placed because we still haven't gotten all those numbers together, but this does give us a great means to reach back out to them. And a lot of times we don't even have to reach out to them, they call us before we're following up with them. And we get them right back into treatment. Do they come through the program more than once? Absolutely. But that makes us feel better that they trust us and they can walk right in again and ask for help with no judgment.
Hello, my name is Chris Wodrowski, and first of all, I'm a person in long-term recovery, and for me that means I haven't had a drink or a drug since October 6th of 2008. I was with a client earlier, and I just realized that that's coming up. I was like, yeah, calendars are interesting. So I'm a peer recovery coach. I'm also the coordinator of the Engage program, which is part of Hydera Health, Inc. And the Engage program is a crisis intervention team that sends peer recovery coaches out to hospitals in and around Wayne County to service Wayne County residents who have Medicaid, Healthy Michigan, or nothing. And even if they have private insurance, we're able to help them as far as like peer recovery or recovery support services, and they have to use their private insurance to find their treatment. We definitely help them navigate through the system. So in order for them to get a referral, they go to a hospital for really any reason. Sometimes it's clearly obvious why they're in the hospital. It's an overdose or alcohol intoxication. We get a lot of calls from emergency rooms, but we also get calls from other floors of the hospital. I've been able to infiltrate just about every area of all the hospitals in the area. The janitors know our program. Someone might go in for a test, and they don't drink for a couple days. And then they start to go into withdrawals. And then the doctor goes, why are you going into withdrawals? And then it comes to find out that the person might not have been as forthcoming on their paperwork, and they, finds out that they are taking abusing prescription drugs or taking illicit drugs or drinking. So then when that happens, a social worker usually comes in and talks to them and offers our services among others, and they say yes or no, would you like to talk to somebody? And we don't usually, I try to tell the social workers to be very specific as far as like certain language. Don't say treatment, say recovery. Ask if you would just like to talk to somebody about some options, so that way they're not pushing anything on them too aggressively, because that being pushed too aggressively, they're going to leave the hospital, as she just said. And pretty sure, I'm shocked to hear that, but I'm pretty sure I'll have to ask my clients if when they leave the hospital if they're running over to the police station. So the Engage program started in May of 2017, and like I said, the reason why I say I work with Wayne County hospitals and surrounding hospitals is that sometimes Wayne County residents find themselves out of county. I was at Beaumont Farmington Hills earlier with a Wayne County resident, and we go to other hospitals that are outside of Wayne County, and we use all the providers that are offered through Detroit Wayne Mental Health Authority. So they are open to whatever treatment option and treatment facility that they would either prefer or is available or both. So when I say option is that when we get into the hospital and we get them to agree to join our program as their peer recovery coach, then we are kind of locked in that service for 60 days. And during that 60 days, we try to work with them to figure out what they want as far as treatment option, and also what they want as resources. Because they're not cured when they leave treatment, or if they go to detox, they're not cured of really anything. So we try to go with them to meetings or groups or outpatient therapy, or really try to follow them around and get them acclimated into some sort of recovery plan versus just a treatment plan and then you're done. And then obviously the programs that we want to, the resources that we want them to get involved with go much longer than 60 days in theory. I had previous experience working with hospitals. Like Lauren mentioned, I used to work in Washtenaw County. I recognized Jason when he came in. I worked for an agency. One of the many things that I did was I had the opportunity to go to the couple hospitals that are out there and work with individuals there and kind of help them along the way there. It's an interesting program to say the least, because we never know what we're really walking into, even with the information that we get from the social worker. A lot of times things pop up once we arrive, but we've also been able to do something that I don't think previously was done before, really anywhere, which is go into the hospitals and then go see them again in the hospital, and then go see them again in the hospital, and not just go, okay, now here's a really bad copy of a copy of a copy with a bunch of phone numbers that you can't read. And when you leave the hospital, call these numbers and you'll be great. We go in, and if they're not medically cleared, we'll get them screened. We'll try to get them screened for our services by calling Darlene's favorite phone number. 1-800-241-4949, and we'll try to get them through that process, which that can be, that can be difficult at times too. So we help them through that process, and we keep them motivated. And then from there, once they're signed up with us, we just work with them until we can find them the next place to go. So in theory, that's inpatient treatment, but not always. A lot of times they want to do outpatient treatment or day treatment, or just regular outpatient treatment, or sometimes they don't even know what they want to do yet, but they like us because we're in recovery and we're not mean to them like maybe a nurse was or something like that. So we try to reduce stigma while we're in the hospital. We talk to nurses and doctors, and we've developed some really good relationships. When the program first started, I have to say that I got some pretty bad remarks from some of the hospital staff. Very typical, stigmatizing language, and I challenged it every time. And I won over some people, and some other people kind of stay out of our way when we go in there, and that's fine too. We're removing barriers to treatment, and I think that's it. Oh yeah, we follow a multiple pathway approach, meaning like when we find resources for them, it's not just a 12-step meeting that we're trying to take them to. We also promote smart recovery, recovery dharma, refuge recovery, really anything that they can do. We work with the people from the addiction/recovery community that have been to treatment 20, 30 times. And they've been to AA a million times, and they're really burned out on all of it. So we try to come up with new solutions instead of beating them over the head with the old stuff and saying, well, if you don't do this, you're gonna, and eventually we can, once they feel comfortable doing something that they feel more invested in, the other stuff, seems a lot more comfortable.
I have a question. I'm interested in young people, middle school, high school, and college. And there was a situation in Texas not too long ago where a young man was on life support for vaping. He's okay now, he's in the hospital 30 days, and now Michigan passed a law what age group that you're working with or what kind of addiction, because I've been to other meetings this year primarily about marijuana and a little bit about the vaping. It wasn't a big deal, but now with the explosion on college campuses with drugs, what are they doing as far as if a young person has to go into the hospital? A lot of the law enforcement people are talking about marijuana just abstaining from it, but if a young person enjoys using these drugs, how do you help them get into recovery? It's always been kind of mind-boggling when you hear one side of it and then, you've got another side of it, and now that vaping is becoming very dangerous, lacing chemicals and you're ending up on life support. Now they're looking into it, but what about the marijuana? And because you don't really see a lot of young people in the hospital for that. They just tell you that you've got to learn to teach the young person to sustain from the marijuana, but they feel that since it's legalized, it's not that the adults are just making up these stories. You see about the marijuana, but it's serious, and it's very frustrating to people that want to work in the community, volunteering. We're hearing one side from law enforcement and other groups that it's not a really big deal. Just teach the young person to sustain from it, but they enjoy using it until they go to a higher drug. So how do you hospitalize somebody that has that mindset?
Specific to my program, we look at marijuana like any other drug. We've had several clients who are young-ish, and my program does take adolescents, provided all the consent paperwork, guardian, all that stuff's taken care of. But most of our clients are adults, 18 and up, and I don't know how any other way of saying it, but we work with people who smoke themselves sick. And so you definitely can be hospitalized with marijuana, 100%. It's an easy drug to abuse, just like any of the other ones. And if you can get it in mass quantities and you don't know your limits, my dad used to say you're gonna smoke yourself stupid, but they can actually literally make themselves sick. It affects their lungs, it affects their brain. I mean, it can have some really, really horrible consequences. And we've had several people referred just for marijuana. Now, granted, we get a lot of polysubstance, which is, the slang term is cross-addicted, but polysubstance means they're using, sometimes all of the above. And marijuana is definitely part of that. But for my program specifically, yes, we look at marijuana just like any other drug. Darlene, you want to step
I'm
in?
gonna answer a couple of your questions. For us at Detroit, I think it's on. There you go.
Hi, Darlene Owens from Detroit Wayne Mental Health Authority. Just to piggyback on some of the different things that Chris was talking about, we have many prevention programs that start working with children when they are babes, when they're toddlers. Before talking about the marijuana, right now we're seeing fentanyl coming up in the marijuana, and that's called the atomic bomb. So we're going to see some more overdose deaths. Hate to say it. We're trying to get prepared for it. Our prevention providers are boots on the ground. They're trying to do a lot of education with our kids. We have different programs in elementary, middle school, and high school. So they're out here hitting the pavement. So this is something that we're looking at. Marijuana is the 4th top drug in Wayne County that our folks use. So just want to let you know. Heroin and alcohol used to go back and forth for several years. Heroin is number 1. Alcohol is number 2. 3rd is other opiates. No, cocaine. I'm sorry. Cocaine is also on the rise here in Wayne County. And then other opiates, no, marijuana and then other opiates. So that's how it is for the top 5 here in Wayne County.
A lot of the school districts oppose people coming in and educating them through these parent-teacher organizations. The FBI recently had a good film, very devastating film, and one of the school districts didn't allow them in. So they didn't go to the Board of Education to pursue it, but it seems like people like us that want to help and volunteer, we have a hard, along with the group here, having a hard time to persuade certain school districts that this is a crisis, that we need to come in as parents and community people to kind of educate, because these young people don't believe a word that anybody's saying.
And also, we also have to look at too, that I'm sorry.
I was just gonna say, you know, we're working on the school piece. As I said, we're going into U of D on September 18th, and we go into some of the local schools as well, and we do bring young people in recovery. So we are working on that piece. Darlene?
But also, I'm gonna talk about a few things that we're doing as well, different youth summits, but also let you know too, marijuana is still against the federal law. So that supersedes the state law, so it's still illegal. So we are working with different employers to educate them as well, okay? So, I'm Darlene Owens from Detroit Wayne Mental Health Authority. I talk fast, you guys, but I got a lot of stuff to cover. These are my guys up here, we fund a lot of their different programs. We work very well together, working very well with FAN as well. And that's why I gave them a shout out on the radio the other day. But we're basically here for anyone that has a substance abuse problem that lives in Wayne County. So that means if you have Medicaid, we help you. If you got Healthy Michigan, we help you. If you have no insurance, we help you. If you got Blue Cross Blue Shield or HAP and you have exhausted those benefits and you still need treatment, we help you. That's what we're supposed to do. We're the public safety net. So we're here for not only substance abuse, but mental health services as well. We're available 24 hours, 7 days a week, 365 days of the year. And yes, I do want you to know this number, so please take a pen and write this down. 1-800-241-4949. But what I'm gonna talk about is our substance abuse programs. I see Scott out there smiling. I'm gonna talk about some of the programs that we do with them. Now, we have outpatient programs. We have intensive outpatient programs. We have intensive outpatient with domicile. We have day treatment. We have residential programs, medication-assisted treatment programs. So we fund methadone, Suboxone, Vivitrol, buprenorphine. So whatever it is that we can think of that we have to do, because we know every last one of us in this room are different, and everybody recovers differently. So we make sure that we have everything you can think of. We have close to 200 peer recovery coaches in Wayne County's network, 77 providers, 125 locations. So if you're in the moon and we want your services, we're gonna contract with you, okay? We're gonna make it happen. Some of the different things that we do. We have 2 mobile units now that will come out to any area. So Judge, Matt, if you want our mobile units to come out there in your parking lot, you got space for them, they can come out there. They can do relapse recovery services. They can do Narcan trainings. They can do everything. We do fentanyl testing because we have to think about harm reduction, because some people aren't ready to stop using. Until they do, we're gonna let them know what's in your drugs so you'll know what's going on. So maybe that dealer that you're going to ain't giving you what you think you're getting. We have to look at everything. We pass out condoms. We have to think about it, because our clients go out there spreading the love. We don't want to spread the love like that. So we gotta make sure we take precautions. So we do a little bit of everything. We do the Narcan training. Right now we have 449 saves. We know it's a lot more, but some folks will not say that they have drug problems. In Wayne County, we still got some cities that won't say that they have a drug problem. But we get the medical examiner's report every week, so we know everything. 450, oh, so you got one that you owe me, okay, thank you. All right. We have 4 different agencies that's helping us with Narcan trainings. We have about 10 presenters, and here's one of my wonderful presenters here. We have peer recovery coaches in emergency rooms. We have them in federally qualified health centers. We have them in primary care settings. We have 2 OBOTs, that's office-based opiate treatment programs. So that way, if a client goes there to that doctor, you don't know if they're going there for substance abuse or if you're going there for primary care settings. We're trying to take out every type of stigma in any kind of way that we can. We believe in faith-based. So we have some faith-based organizations that actually have our providers right there where someone can go there. If you don't know if they're going there to worship, they're going there for treatment services. We are funding medication-assisted treatment programs in Wayne County Jail. That's with a GARA program. So we have about 50 clients that are basically there for that program. With personalized nursing life, I ain't gonna steal all your joy, but guess what? We do have Detroit Reentry Center, we have Huron Valley, we have Ryan's facility. So we have peer recovery coaches doing all kinds of different services there. I talked to you about the mobile units. We have 2 of those. We have recovery housing, because sometimes places where our folks live are toxic, so sometimes we gotta take them out of their environment. So we have a whole slew of them, and we have no wait lists. We have 23 residential providers, so no wait lists whatsoever. We have right here in this area, we have recovery homes in Westland, Plymouth, Dearborn Heights. I'm trying to think of this western part of Wayne County. So we have them in Canton as well. So we have them in a whole variety of different places. We're trying to make sure that we have coverage everywhere. Let's see, talk about some of the other different programs. One of the programs that I talked about once before is that we have BABES. Because sometimes you may have that parent, they have that toddler that sees their parent nodding off or what have you, and that mother or father do not want to leave the other one, but they want to get some help for their kids so they can understand what's going on. So we have babes and they work with them with puppets. It is the coolest program that you can imagine. It is really good. It is an evidence-based program that is sanctioned by our federal government, SAMHSA. It is the coolest program, so that's something that's very good. We have programs called Strengthening Families. Not only do they work with that individual, but they work with that entire family because this impacts on everyone in the family. So we have various different programs like that. We also have gambling programs because we know with a lot of our folks, gambling and addiction goes together. So we have gambling programs. We also have human trafficking programs because with all these beautiful events that you see all the time, guess what's going on behind the back? We have human trafficking going on. We have organizations who will come and pick up a whole slew of women, men, what have you. We have transgender programs. We have to think about it. With our transgender population, we were seeing that some folks were getting raped by men or beat up by women, so we had to come up with transgender homes. We have to have something for everyone, and that is our job to do, so we create all of them. We have communicable disease programs because this goes hand in hand with all of our clients as well, so that they're educated as well, screened, looked out for risk behaviors, and also trying to get them those other types of ancillary services that they need. Motivational interviewing. We're doing a lot with training our clinicians as well as our peer recovery coaches to be able to motivate someone, keep them engaged in treatment services. Just like what Chris said, a lot of folks feel like they go through residential or withdrawal management, it used to be called detox. I'm cured. No, you're not. This is something for the rest of your life. You know what I'm saying? This is something that everyone has to work on, and it's okay. Also, to let you know that we believe relapse is a part of recovery. So we know folks are going to slip. Guess what? We're going to be there, and we're going to have a program just for them. We pay for acupuncture services. That decreases cravings for individuals. Again, like I said, one size does not fit all, so we want to make sure that we have a whole slew of programs. We have one program called Intensive Wraparound, in which sometimes somebody may have something that may set them off. Maybe they can't get their children's uniforms, or they need to get their car repaired. We have that program that's funded through Hagera programs as well. We have, what else? God, I got so many different things, you guys. I could go on and on, but I'm not. So many different things that we pay for. We actually have with our medication assistant treatment providers in which they can do door to door. So we do work with Uber. We do work with Lyft, where they can actually go pick up our clients. We're gonna take away that I couldn't make it there. We're gonna come and get you. We're gonna make sure that folks get what they need. That is our job, and we are here for them. Let's see. Oh yes. Let me talk about some of the different conferences. Look at Pat is on my head. Wait a minute. Let me tell you all this. September the 14th is Narcan Day. So basically, any of your major pharmacists and some of the smaller ones that are signed up for the standing order will have Narcan available, no questions asked, don't need your name or anything like that. Our goal here in Wayne County is for every citizen to have a Narcan kit with them at all times. It impacts on every last one of us in this room, so don't think that it does. It does.
Let me jump in for just 1 second based on what you just said. For those of you who don't know, we have a Facebook page. We post all kinds of stuff on that Facebook page all the time. We posted information about that September 14th Narcan Day. There's an article that you can click on a link and it'll give you the list of pharmacies that are participating. So you'll know exactly which ones you can go to and get the free Narcan kit on September 14th.
Also, September the 14th is Celebrate Recovery. This is an annual statewide event on Belle Isle. This starts at 10:30 and goes to something like 4 p.m. We encourage everyone to come. This is folks that are in recovery. These are folks that are in treatment services. We like for our providers to bring all our clients. It's an educational event. It's a family event. So we want everyone to know what's going on, educating them, but also let them know that you can be clean and still have fun. So this is a good event. Our annual substance abuse conference is September 15, 16, and 17 at the place that used to be called Global Hall, but now it's called something else different. I forget the name of it. But we have a youth summit that's coming up September the 12th and the 13th. That's this week, Thursday and Friday. That's going to be at Durfee School. And Diamonds in the Rough is September the 28th, 10 to 3. That's also for all girls. So the youth summit is for boys and girls. The Diamonds in the Rough, September the 28th. That's going to be at Detroit Recovery Project in Detroit. That's for all young ladies. What else? Talking about some of the different programs. Our prevention programs, like I said, those are boots on the ground. They're addressing underage drinking, they're addressing prescription drug abuse. They actually go out to the college campuses, to the dorm rooms, knock on the door and educate those individuals. So it's called the Generation X program. So they actually go to the campuses and the dorm rooms and knock on there and teach them. We have, so they're addressing marijuana, reducing prescription drug abuse, awareness of all various different types of drugs. They're there with the coalitions. The coalitions are anyone from law enforcement and someone from the church, different judges, schools. This is where you have everyone in the community working together to change the environment. Some years ago, we had the city of Detroit where they had a lot of the different billboards that were basically showing it's cool to drink and smoke and all this stuff. So basically a coalition came together to get all that stuff taken down. This is what a coalition does. A coalition is someone that's looking at environmental change and you work to get environmental change, okay? What else? I could go on, but I'm not gonna be that greedy. But just to let you know, we are the public safety net. I think you all should, call our 1-800 number for anyone. Like I said, no insurance. If they do have insurance and exhaustive benefits and still need treatment services, we're the one to call, okay? So I'm gonna give it away to Pat, one of our great providers.
Except I'm gonna interrupt for just 1 second. You mentioned a number of dates of events that I would imagine that people in this room may want to know more about. They wanna know where to go, et cetera. Do they go to your website to find out about this September 12th,
They
September 13th?
They should go on our website. If they aren't, they can email you and I can give you that information.
All right. You can do that. Our email address is on the flyer. And by the way, there's a lot of us from FAN that are gonna be on Belle Isle on September 14th, so, yeah. I see a lot of hands up.
I've got a question. With all the people that you're contracting with, are there barriers for folks in addiction that have records, either through the jail system or the prison system, to participate?
We don't care. Most of our clients all have records. Bottom line is it's about treatment services. That's what we're here to do. I mean, think about it. For someone's drug addict, they did what they had to do. We don't care. A lot of our peer recovery coaches as well have, criminal background histories.
I was specifically.
Doesn't make a difference. We just want to help.
I was specifically thinking about the residential placements that you were mentioning.
Residential, that doesn't make any difference whatsoever. We do have specific places for sex offenders, because we have to be a certain feet away from schools and what have you and stuff. But we have specific facilities for that. But having a criminal history doesn't make a difference. As long as you pick up that phone and make that call, it's our job to place you.
Thank you.
You're welcome. Get somebody back there and then we'll take them here. Yes, ma'am.
Do you guys have anything to help, not necessarily young mothers, but mothers who have been in recovery throughout their pregnancy, helping them after pregnancy to continue recovery?
We have programs in which a mother can come with 6 kids and she can still be pregnant. We have residential programs, yes ma'am, that she can bring all her children as well, yes. And then also, we have statewide contracts for a woman that can come with her 6 kids and pregnant for a year or 2, and that's Odyssey House. So that's something that we pay for that is in Flint and Saginaw. But our programs, we have 3 of them in Wayne County in the Detroit area that we can take care of. Yes, ma'am. Yes, ma'am.
You're talking on the online stuff all the time, and a lot of us are computer illiterate, and then there are others of us who can't be on a computer because we're photosensitive.
Mm-hmm.
We break out into a seizure.
Mm-hmm.
So why cannot a lot of this stuff be written down and passed out?
Actually, we do have a provider directory, and I did not bring any, and that's something that we can make sure that we can give Pat here, we can make sure he gets a ton of them. And that's our provider directory, and most folks do love that because it has all of our providers and what have you. So yes, ma'am, we do have that.
And for what we do, we have flyers for everything over there.
I'm aware of that, but there's new folks that are.
Yes, so we do. I'm like you, I'm old school too, so I'm with you. Yes, ma'am.
So you said your residential house, do you have some that allow children? How do we find out about these places?
What you do is call the 1-800 number, which is also in that provider directory that I'll make sure that you all get some copies of. I'll make sure that they get here for your next meeting that you come for FAN, you have them. But you can always call our 1-800 number and you can ask about them, but those are Salvation Army, Evangeline, and also Positive Images. So those are ones that you can take your children with you. And we do have plenty of women's programs in which they're pregnant, they can come into treatment services. We actually have one provider that helps us out with all of our women that are opiate addicted, that are pregnant, and that's University Physicians Group. That way they can make sure that they get their prenatal care as well as substance abuse treatment as well as methadone. And methadone is still the best medication to use with a woman that is opiate addicted. Who's next?
We were still on the same question?
Yes, ma'am.
Okay, we were both drug addicts.
Yes, ma'am.
And both in the way past recovery and going hopefully forward. Okay, knowing that, we live together, and I'm helping her raise her sons, and we help other people that need a place to stay while they're trying not to use period at home, so they're allowed to come here. In other words, if we live together, we plan on spending the rest of our lives together while I finish my life, can I join her also in that recovery program in order to stay with her?
Because you're in recovery as well, so the thing is, when you call our 1-800 number,
I'm
you
over
can,
140 days.
so that's excellent, so yes, ma'am. So you can call our access number, and then you're gonna do a brief screening, it only takes about 15 minutes, and you can talk about what's going on, and yes, ma'am, we can put you in recovery.
We're not together.
That all depends upon you all, if that's what you wanna do, it's about choice, right?
What we want.
Right, so that's about choice. Now, recovery homes are only up to 4 months, unless it's based on medical necessity, and then we can go higher than that, but it's up to 4 months.
Wonderful.
Our goal is to always help folks to get, into suitable housing. So we want every client to have a therapist, a case manager, and a peer recovery coach, so that way they have that wraparound services.
Wonderful, wonderful. Thank you very much. Really
Yes, ma'am.
clarified that question.
And so you call the 1-800 number also for the wraparound?
You call that 1-800 number for everything. For everything. 1-800-241-4949 for everything. Yes, ma'am. You should see our billboards, they should be all over Wayne County, as well as on bus signage, radio, TV, we have done everything we can. Oh, I forgot to tell you all this, and I'll leave it alone. I wanted to give you some data, and I'll leave it alone. For all the efforts that all of us, all of our providers, and everyone has done, we have brought down opiate overdose. Well, the opiate, drug overdose deaths, mainly opiate overdose. So 2016, we had 849. 2017, it went up to 997. 2018, down to 915, an 8.2% decline. Just want to let you know. It's all efforts, all of us.
Darlene, those numbers are Wayne County, right?
Yes, only Wayne County, that's my concern. I mean, I'm concerned about the world, but Wayne County is undoubtedly.
So I want to start first, as you can see who I am, is to thank Lauren and Dara and the board of FAN, the advisory board, which I'm a part of, to bringing us all together. Because this is a community problem, this is a huge problem, and we all need to work together, all of us. And there's been a lot of proud moments in my life. My recovery is number one, because without that I wouldn't have my children or my wife. But one of the other proud moments was when I was asked to be on the FAN advisory. And I really mean that from my heart. It's very important to me. I'm going to tell you just a little bit about me, and then I'm going to get into our program, because I want you to know where I came from. So 2,060 days ago today, that's actually 2,060, 59 days ago today. Well, around 2,060 days ago today, I woke up in the Canton jail to a detective wanting to speak to me. Now, being a professional in addiction at that point in my life, detectives don't come and talk to you unless there's a real problem. You're video arraigned in your cutlass, like the other 2 times I was in Canton, because I was a habitual drunk driver, and I blew in the high 3s. When the detective came to speak to me, he informed me that I, in a 15-hour blackout from alcohol, opiates, and Adderall, assaulted a female police officer. First of all, I hit a woman. That's disgusting. Next of all, that I hit a woman who was a police officer. mine 30 years of addiction. I ended up previously 4 times in a very high-end rehab at $1,000 a day. It's not the rehab's fault, it's mine. I was enabled, which is not the fault of the individuals that enabled me either. It was mine. When I went into, which is now closed, a closed down convent in 12 Mile and Stevenson called Eastwood Clinics, the Detroit Wayne Mental Health Authority paid $105 a day for me to stay there. Now, those of you who know me know that it's very difficult for me to get through this without getting emotional, but it's because of the Detroit Wayne Mental Health Authority that I'm not dead or I'm not in prison. So they paid for that stint of my treatment there. I lived there homeless for 17 months. When I was dropped off there by my wife, these are the words that she used. And I'm going to get to a happier time here. You people do with him whatever you people do with you people when you people are done doing with whatever you people do with you people. And then just to kind of put a cherry there, she said, don't call your sons because they are no longer your sons. I need to protect them. 2,060 days later, I'm here. And part of that is because of the Detroit Wayne Mental Health Authority. The other part of it is because of treatment courts. 35th District Court is what I went through. Sobriety court for 2 years. And the other part of it is because at 12 Mile and Stevenson, in that closed down convent, that's where I met my first peer recovery coach. And that's where I got honest. And that's where I surrendered. And that's where I accepted that I have a disease, and I will have this disease, a disease, for the rest of my life. I cannot use drugs, and I cannot drink alcohol. So, this brings me to now, and to thank again for all of us to be here together. So, a little over 3 years ago, a good friend of GrowthWorks, I was their only peer recovery coach then, wanted me to try to explain our program. So, a good friend of mine, Josh Meisler, who is a clinician in our Juvenile Justice Center in Washington County, and I went to Pawtucket, Rhode Island. Pawtucket, Rhode Island? What's there? Well, I'll tell you what's there. Every single hospital in Rhode Island has got to provide peer recovery coaches, or they cannot be a hospital. I said, no way. How can the government tell a hospital that they have to do? They didn't. So Anchor Peer Recovery started this out there because that part of the country was hit very hard. So they were the only game in town, and they had coaches that went there. So we paid money to go there and see this for 3 days, which was genius because the money that we paid them went right back into the program. They said, here's everything that we have in a binder about this big. They said, take it back to Michigan and put it in place. Just change the name. Put GrowthWorks, whatever you're going to call it. We didn't call it Rescue Recovery. So we brought it back. And we have had a long, long relationship way before me with St. Mary's Hospital in Livonia, and I was born there, surprisingly enough. They're amazing. Our partnership with that hospital, we're blessed. All of our coaches are badged through St. Mary's, and we're able to go to the chemical dependency unit, the behavioral health unit, the med floor, and also the ICU through when we're needed to go to those particular areas. And we have also been called into the cancer center, which is powerful in itself. So we're able to respond there 24/7, 365 to give services to individuals who are asked by the social workers, doctors, or nurses if they want to see a peer recovery coach. If they do, we're there 24/7, 365. Our response time is 35 minutes. Now, if they don't want to see us, this is interesting. We took this model from Anchor as well. And they say they want to see a coach when they leave there. Typically in our world, I want to use it. Right? We blow their phone up for 10 days straight. Just keep blowing it up. Our coaches will wake up 2, 3 in the morning, boop, boop, hello, hello, hello. And then you don't get a lot of response, but then you get the response because they're ticked off. What we work off of is a moment of clarity. That's what we all work off, is that moment of clarity. I need help and I need it now. I woke up in jail, I hit a police officer, she's a female, my family wants something, I need help. I need help. So we respond, we're resource brokers in a sense, right? We connect people through our first line of defense, the Detroit Wayne Mental Health Authority. So if they have insurance, we call the insurance in the back of the number on the card with them. If they don't have insurance, we call 1-800-241-4949. And we get somebody from one place, the Detroit Mental Health Authority, and we get them into treatment. Now, the 10-day call list is interesting because we have a 75% success rate with getting the 10-day call list people into services. That's amazing in itself. We have coaches that are called 3 months later going, you blew my phone up, now I need your help. You got it, we're here. So we go. We're on 5 different treatment court panels as well. One of the effectivenesses of that is that a lot of our coaches have been through treatment courts. Now, we're not mental health, we're substance use disorder, so we're alcohol, drug courts, or the combines. So we're able to help the individuals that are involved in the treatment courts navigate the system. Help them to realize that no, you can't take NyQuil. And no, the judge isn't gonna go, oh, it's okay, no, they're not going. And the judge is also not gonna understand that they understand a dilute screen, but not 6 of them. So we help them to understand that we're walking in the shoes that you walked in. I lied to the judge. Not you, because I didn't make him win. The judge turned me plenty of times. But we're here to help navigate that system, and that system saved my life because it helped me to become manageable again through those consequences. The other piece of it is we do deal with 6 different police departments, and they deal with those different jurisdictions of courts where judges on the bench will say to their court officers, call GrowthWorks, get a peer recovery coach in here right now, or send us to the police department during the video arraignment. If you get him into treatment, I'm not going to send him to jail, but he's still going to have the consequence. We still need to deal with the consequence because that consequence is what also helped me get sober. So we're able to help with that too. We have peer coaches in juvenile justice in Washtenaw County that work with the kids that are there. And we also have a respite center that Wolverine Human Services runs in Vassar, Michigan, that we have now coaches starting to work in with that too. Every one of our clinical groups has a peer coach to it. So it's a clinical team. The clinicians are in charge. We bring experience, strength, and hope. We help navigate the recovery process. As Chris so nicely said, we're multiple pathways to recovery. AA and NA is what got me. I got it through that, and I still work that program. But there's multiple pathways, and we advocate for that. We have 18 certified peer recovery coaches from the Michigan Department of Health and Human Services. Through their program, and many of us are also C-card, and many of us also have our Michigan certified peer recovery mentor or a development plan. But with the piece of the Michigan Department of Health and Human Services is you have to be in recovery for at least 2 years. You had to have been provided services from PHIP, the Detroit Wayne Mental Health Authority, Oakland County Community Mental Health Care, in Oakland County, someone that, so that you're giving back to that community and you must be employed. So that's part of like what we're giving back. I go back to the piece with St. Mary's because without that platform, we would have not been able to be where we are today, and that collaboration is wonderful. I cannot wait to work with you. I will say this publicly, I have never met you, but I follow everything that you do. You, sir, are a champion of recovery and clinical peace to the needs of the world. And I applaud you, Jason. I applaud you because we are blessed to have you. Just like we are, Scott, all of us, we're all here for one mission, and that is to help the next person get into recovery. Are there any questions? I'll be here after. You can ask me, Ben. Thank you, Fan. Thank you, Holding Handcuffs. Michelle, one of our coaches.
How long do your coaches stay with their clients?
Our coaches will stay up to a year with the clients based on the need of the client. That brings also a point to you, since I saw that smiling face. We do work with the kids in schools as well. Michelle does that. She educates on vapes. And we also educate within the community as well. We do some things at Van Buren Township. We're gonna be coming up on Thursday. I'll be doing with Darlene. We do Narcan training. I Narcan train on behalf of the Detroit Women Health Authority. We also have coaches that help navigate the human trafficking issue. We've had a coach go to juvenile justice in Washington County where there's been suspected instances of the kids being human trafficked, and the coaches will work with them there. It's interesting because another question came about background. You know, McDonald probably hires, but our backgrounds is our PhDs, our master's degrees. You know, and many of our coaches are going to school to be clinicians. Michelle has a BSW, Allison as well. They're going to get their masters. And we have, that's what this is all about. It's about going from a high six-figure job to living homeless for 17 months.
Whoa.
But then coming back and being able to give back your life repurposed, being able to give back. So our credibility is our background. It's our use. So I got somebody that's just smoking weed unstoppable. I like what your dad said. Because it's also not grandma's weed anymore that's out there, right? So I don't have a heroin coach in recovery from heroin. Typically work with somebody that's addicted to marijuana. I can, but I want to get things kind of honed into that specific, you know, use. Yes.
How do you go about getting a peer recovery coach or choose like this big rig? How do you?
So there's two different ways, multiple, anybody can chime in. My original certification was from the Connecticut Community for Addiction Recovery, CCOP. You don't have to be in recovery to get that, but that back when I got it 40 years ago, that was the only game in town. Then the state got involved. And then the state got involved and has some different requirements. Now the Detroit Wayne Mental Health Authority that GrowthWorks is funded by has certain requirements, as well as because of Medicaid funding. There's certain certifications that you have to provide this particular type of service and here. So you can't just have a C card. But what we choose to do is we choose to have our coaches, because they are all in recovery, certified through the Michigan Department of Health and Human Services and the Michigan Certification Addiction Board of Professionals.
So I mean, like,
How do you
a
get it?
person that's, you know, sober, wanting a peer recovery coach.
Oh, thank you.
Sorry.
So, no, that's what I thought you were asking the other thing. What you would do is you would contact our agency, Chris's agency, and then also Tim's through White House. Tim does two different things. Or the Detroit Wayne Mental Health Authority. Yeah.
1-800-241.
4949. Yeah, you can call the Detroit Wayne Mental Health Authority.
My point is there a restriction on gender to gender?
Yes. Our coaches only work gender period in the store.
But also, you said you would like specifically not with a heroin person, with a person in
Right.
Typically, that's how we're.
Determine how it's like.
Well, your drug of choice. If your drug of choice is heroin, I'll have a coach that's in recovery from heroin work with you.
And remember, some things are gonna be different per agency,
Correct.
that's under our umbrella. So
Right.
like Chris was saying,
Yeah.
it doesn't make a difference with gender, because it doesn't, you know what I'm saying? But for, GrowthWorks, that's a difference, and that's something that we respect. But it's actually what that individual wants. If you want a female, then you can get a female peer recovery coach. If you want a male, that's fine too. But we're gonna make sure, because we know with a lot of our clients, we always have to teach about ethics, to make sure that people do not cross those boundaries.
Right, absolutely.
Right. See, with the gender-specific piece to it, and we also have gender-specific groups, where we'll go with the gender-specific piece to it is if I have coaches on call and they go to St. Mary's, I may send a coach to see if I have a male coach will see a female, but there'll be somebody else in the room. But ultimately, we'll assign them a gender-specific coach. That's our, that's what we modeled after.
Like a person couldn't choose who they wanted to be their peer recovery coach?
You could choose, if you want to interview the coaches, you could choose, but with our particular program, we're gender specific and that's it. That's how we modeled it after the Rhode Island model, and that's what we do. We typically, and again, there's a lot of things in early recovery that happen. That's why we choose to stay with Cherish specifically.
I'm gonna jump in on that just real quick. So based on, again, like Darlene said, it's specific to programs, it's specific to agencies. I don't have the luxury of kind of picking a male and a female right now. I mean, I wish I had that kind of staff, but if I have a female on staff and it's a male in the hospital, then at that moment, that person gets a female peer recovery coach, and it doesn't matter what substance it is, as long as it falls under any substance. And I also have peer recovery coaches on my team that are poly substance users, so it's just kind of like throw a dart at it, it's fine. If they prefer after the fact to work with a male or a female, then we can make adjustments for like what we call follow-up care. Kind of like Pat was saying, like after the fact, like eventually we might be able to accommodate. And we've had what I call, I let my staff know that if you're the first person to see that client, they get what I kind of came up with it, but it's not a clinical term, it's called a coach crush. And meaning that the first person that you connect with, you might want to see that person again, because you feel more comfortable with that person than anyone else, regardless of gender. Yeah, it's all about establishing a good rapport. Unfortunately, if that's a part-time worker that only works a couple times a week, and we want this person to work, every day, they're going to have to work with whatever coach we have available that day, and it's up to the client to really, answer the phone and agree to meet with us and all that.
Well, I am blessed to have a big staff. So, very blessed to have. Yeah.
So one question on all of this. I'm sorry.
I'll tell you what, can you hold your question for just a minute and let Tim Tout speak first, because he's also a peer recovery coach, and he may also want to weigh in on your question. So let's let Tim do his thing, and then you can ask your question, and then everybody will be engaged, all right?
My name is Tim Tout. As I've listened and we've gone down here, I thought about what I was, the best way to be able to be here as a resource for people that need the resource. And as I listened to, my colleagues, and definitely somebody who's made me who I am today was I came in to working in recovery in 2009 through Hagera Services, and I worked in a residential treatment center for 10 years at Oakdale Recovery Center. And there was no such thing as peer recovery coaches. There's no such thing as helping people kind of after care. We were just starting to come up with these programs. So I'm kind of the dinosaur, the grandfather of all of that, because I was one of the first 100 in the state of Michigan to actually be certified. And at this point, too, is I really like the title that they've given us is that we're a mentor, that we're not a peer recovery coach anymore, that we're a peer recovery mentor. And I guess that will go for my next one is that I got introduced to this awesome woman, the Honorable Judge Laura Mack, who through Hagera Services, I got to be put on to her behavioral health treatment court team. And I run a relapse prevention group on Sundays for the last 5 years or more, if even more. And that's how I got part of FAN or coming to the FAN meetings also. And my next great adventure was to go into Ryan Road Prison. And I now am part of MyRep is the name of it, or the CJ Project. I worked 3 months with the incarcerated prisoner, and then I worked 6 months on the streets of Detroit with the 6-month prisoner to be able to get him back onto the streets and back into somewhat of a normal. And let me tell you, it's interesting because I'm sure that Scott can verify this too, because he gave me a ton of different projects while working for Hagera that he just handed me and he said, here, go do this and make it work. And one of them was the Local 900 UAW that I did for over 7 years, taking people and going and picking them up all over Western Wayne and taking them to a support group every Thursday evening at the Local 900 across from there. The support group that Judge Mack has given me, I don't even know how to describe it, but the best way to describe it is it's their group. It's they're on probation for a year, and they, it's it's really hard to describe, especially the families here have touched me in such a certain way that I don't know, and I take back what you guys share with me to the clients in all these different programs that I've had, that I've gotten to work in. The other nice thing is that I'm under the umbrella of Plymouth Lighthouse, or the Personalized Nursing Lighthouse, and half the people that I ran into when I walked into the Plymouth location were ex-clients of mine from one place. My name and my face is everywhere in recovery because I never stop. I knock on doors, I open doors, I walk into places, I introduce myself. I ask them, what can you do for the people that I'm working for? One of the most interesting things is there's a guy that owns a 3-quarter house in Redford, Livonia, Inkster, Garden City that I've worked with since, and I found his name in a drawer at Oakdale, Nodi, and I called and introduced myself and started making, and I just got one of my parolees into one of his houses, and the guy looked at him and he says, how long have you known this idiot, as he called me, so nicely, and he said, for about 12 years now. And he said, you must get sick of him calling day in and day out trying to find a house for somebody off the streets. And he said, you know what, I've never got sick of him because over the last 12 years, he's never called asking for a favor for himself. He's always asking for a favor for something in need and to do. And I think for all of us that this isn't about me, this isn't about, you know, what I've done, how many years I have in recovery, where I started this journey. I mean, I'm really grateful to Hagera for giving me the opportunity, educating me, and giving me the certifications in Detroit Wayne for standing behind me for some of the things that I do that, and I was thinking, you know, these guys are talking about these services. The worst thing that Hagera ever did to me is they gave me a cell phone. And attached to that cell phone were business cards that they handed out to everybody. And still to this day, almost 10 years later, I get calls from people that I met when I first got that cell phone because the number has never changed. I still carry it because of the court program. And you know, the problem is I actually attach my personal number to my new job, so now there's all across Detroit Wayne, and that phone rings constantly too. But it's incredible because it's not only the people looking for help, but it's the people that are in resources. And one of my favorite things to do too is I link the clients to each other. Once they've gained enough recovery and they're out there in the community, I got people that have been in the program, have been sober for, I think he's got 5 years, that owns his own painting company now, and takes on people all the time in recovery to be able to give them jobs. I got another guy that's, you know, just over a year that's a general contractor. They love mentoring. They take on, I got guys that sponsor constantly. This is the way that recovery works in my world. And I'm just, you know, somebody asked me one time, they looked at me and they said, oh my God, those words were incredible. And I looked at them and I was like, I couldn't even remember what I actually said to them. And I said, you know, I'm basically a vessel at this point in time. And whether my spiritual, it's God. It speaks before me. You know, I got a gift that I got laid off for the last time out of the corporate world. And I decided, you know, I'm not going back into the corporate world, and I took a chance. You know, it was my ex-wife that was a nurse at Oakdale that said, why don't you come here, try this. So, I don't know if that helps, if it explains anything what we do out there, but there's so many different programs. Every time I walk through a door, Detroit Wayne Mental Health has posters all over the lobbies and stuff, and I'm like, oh, this is just another link that I already knew about, but some of it is actually being there. I want to go back to the mentor part. If anything that I can say about a recovery coach or mentor is, the one thing that I know is, you know, I sat in a DHS office for 4.5 hours with one of my parolees today to be able to find out that he wasn't going to get a bridge card after the third try because they had screwed up his case. And he has anxiety, he has anger issues, and somehow or another I got him to sit there for 4 hours. And he didn't use the B word at the end of it, when the case manager came out and told him, you are not getting one today. He walked out nicely, didn't say anything, and I don't know about anybody else, but when I was growing up and when I was in my addiction, I didn't have anybody that sat next to me.
Yeah.
I didn't have anybody that walked through doors that I was so scared to open that, you know, the fear would keep me on the outside of them. I didn't have people that said that you're gonna be okay today, you know, that we're gonna get through this. You know, that you're falling down again, you know, I've dug guys out of crack houses, you know, that decided to go back out, and we got them treatment, and we got them into recovery, and we got them out of, you know, off of what they call paper. It's amazing. I mean, we even have, one of the people I worked years with is actually working at Oakdale Recovery Center, helping other people, and she's not the first one that we put through that. This works if the client, or if the person, or if your family member, but we have to work together. It's the biggest thing, is that, I think Pat said it so well, is that, you know, in all aspects, and, you know, what my privilege is that I kind of, they've turned the other way, or they've let me kind of loose at certain points in times, because I work all over the streets of Detroit. You know, I work with different organizations, and I work with, you know, through Detroit Wayne. I use every resource that's sitting up here on top of other ones that I've had to go out and find on my own. So never, ever give up. Number one, on the people in recovery, don't give up on yourselves. You know, that's the most. Don't give up on your loved ones. I love the story about, you know, your boys and how they've come through and stuff. And, you know, even if they're walking down 5 years, I hope you never have to see the conditions that they're in. And I hope you can love them when they come out, because that's the biggest thing that they need. There's so many of us that have made the mistakes that have absolutely nobody when we're walking out those doors. And, you know, that's the gift I've been given, is that I can be there to help these guys. You know, people walking out of 20-year sentences that, you know, haven't been out of prison for 20 years, and, you know, they have to count on me to pick them up at the doors. Imagine that.
I was just gonna ask that question. For anyone on the panel or all on the panel, how many times per day can you call your coach? Does it matter, is there a time limit to the phone call?
Yeah.
Just between each other?
Not when it comes to my services. I get 24/7.
He'll talk to you as long as you need.
Yeah.
I've seen him talk for hours. With somebody who's in a crisis. I mean,
That's
well,
wonderful, that's wonderful. So, you can have 5 clients in one day, you need to have 5 lines to talk to them all.
You learn how to balance.
Yeah.
It's a part of life.
Right.
We've met with clients on multiple times in one day. A lot of times it's, we'll go in one time to see them, and they might still be sedated from the medications that they were on the night before.
Okay.
I choose not to have people sign consent forms when they're heavily sedated. So, we come back later in the day. Sometimes we get everything set up during the day. They come back later and transport, because I don't know if I mentioned that earlier, we're a 100% mobile program. So we take them to treatment, we come pick them up from treatment. We'll take them to meetings, we'll take them to DHS. We've done that, that's wonderful. We take them really anywhere they need to go, within reason. And, yeah, we've seen multiple clients multiple times, and I've seen the scheduling calendar from the weekends, and seen that my weekend staff is just killing it. They're all over the place. And they're all over, they're downriver, they're downtown Detroit, they're western Wayne, they're everywhere.
Trust me, I've gotten phone calls too, like this morning from Van and home.
Yep. And she is there for us too.
That's what I do.
That's wonderful, so it doesn't matter how long you've been sober, if you've ever had, what do they call them, peer support person?
So that's why we have relapse recovery programs, because you may be
What if
tempted
you
to go
don't
back
have
down
to
that,
relapse?
you know, that lane. So we have to have programs in place for the continuum of care for any and every person.
Oh, that's great. This is simply great. I have no one, but I have everyone that comes to me for help. And the only thing, you know, what you have to do to speak with someone is to make sure that what you got up here, you can bring it out here and give it to them. Because you're not easy, so you can give them some type of hope. Because I have one, so proud of her. Wonderful. Thank you, everyone.
I have a frightening question. First thing, I'm happy to be here. I was introduced to FAN about 2 years ago from one of the, I would consider a substance abuse icon in our area. Needless to say, you know, I'm a person also in long-term recovery, but I know that this is geared towards families, right? I mean, generally speaking, and I know that I've heard a lot of families.
We are happy to have
Well,
both, actually.
I know that every family has some relationship with addiction. That's almost a fact, probably, okay? So needless to say, this is an opinion question, because we all have our ways of handling this situation. With the person in early recovery, number one, denial, dealing with denial with this question, okay? Going through treatment, you get a certificate, right? Hang on, I know, he's laughing already, he knows where I'm going. You get key tags, and a lot of us put it on our legs, okay? Mom is happy as hell to see me smiling and looking clean. Mom, I need a job. Mom, I need a car. Can you co-sign with me, Mom, to get a car? You know, because I've got to get there. I have got to. I mean, come on. You don't want me to use your car. I mean, do I have to go further? No. Okay, so the point is that many of us in early recovery have a significant denial or a level of manipulation. Let me use that as a term. You know, most of us in long-term recovery, we're still working on it. Well, needless to say, you know, I'm just asking, how do you tell a family that who are so damn happy to get their child, adult, you know, family member into treatment? Thank God it's been 6 months, okay? And I want to help. How do we coach that family member? Because I guarantee you there's families that want to know this right now.
But that's why we have FAN.
All right.
Families against narcotics. Because
Yeah.
they don't educate the family.
I'm gonna piggyback on that. That's exactly what we do, and that's the reason why FAN is starting a family recovery coach program. We help those families make those boundaries. Because you can't be giving after 60, 90 days. I used to reward my boys, and within 2 weeks later, they would relapse.
To just add to that, that's also why we have our family and friends support group that meets twice a month, the second and fourth Tuesday of every month. Because the other thing that's true, those of us who are in the position of family members who've dealt with a loved one with addiction, is that it's not one size fits all. It's a very individual thing. So it's not the kind of thing where you can just say, give an answer to your question and say, here's the answer for every family member dealing with the situation you just described. Because every situation is unique, depending on that family, on that individual. So it requires an individual type of ongoing communication, which is why we have the family support group.
I have an interesting relationship with families based on the location where I meet people, because sometimes in the midst of working with the client, the family will enter the room and start yelling at the client, or start crying and showing, you know, whatever type of emotion, and sometimes it helps with the process of getting this person on with that rapport that we were talking about. Other times it's completely derailing. And I either have to start over or come back later when the family's not there. I've had to ask family members to leave because I'm not allowed to talk to them until they sign. I've had clients tell me, I'm not gonna sign, I don't want my family, I don't wanna talk to my family, I don't want you to talk to my family. When I do have the opportunity to talk to family, I provide them resources and I try to give them, and again, I'm working with time restraints too, so I don't really have a whole lot of time for me personally to sit down with the family unless it's a follow-up opportunity. But I provide resources. I let them know about Al-Anon. Smart Recovery has a friends and family plan. I definitely let them know about FAN. I let them know about the different chapters depending on what area I'm in that day. And I try to let them know. I try not to sugarcoat it either. You know, I tell them if they're going to detox or treatment, they're not going to be cured. They're going to need help when they get back. You know, if you're not welcome home, it's fine. At least just let me know. Be honest with me, so I know what I'm working with. If they're not, welcome home after treatment, you need to let, you know, your son know that, so he'll be more inclined to help work with me, maybe transitional housing. So it's an interesting factor, and I've gotten calls from family afterwards and emails, you know, thanking us for the work that we've done. And even with the really rough families, and sometimes families are the last person we want hanging out with our clients. So it's really, it really depends on the situation. Exactly.
I just want to say that, I mean, to hear the panel, it sounds like there's all these recovery, there's all these treatment facilities, all these recovery housing. That's not really true, though. I mean, there's shortages.
Not in
Treatment,
substance abuse, mental health, not in substance abuse, I have to
but what
say.
about both? People suffering from both?
We have our clinicians, like say the GARE programs, they are co-occurring enhanced, they can take both mental health and substance abuse. So we have co-occurring capable providers, so.
But the reality is different, though. I mean, the resources are constantly shifting. It's very hard to stay on top of, you know, where you can get somebody in. I mean, Tim, you know, we've had experiences being on the phone with Well Place.
Right.
The screener's not available, they try calling back.
That
You
is
gotta
something
call
that we're
them.
addressing. I have to agree, that is something that we are addressing, that's why we have an email. I don't know if you got the information that if you have a complaint, you put it in there, and we're addressing that with
Okay.
Well Place.
Good.
So that is something, but just like when Fan and Hope Not Handcuffs have a problem 2 o'clock in the morning, they
Yeah.
call me, and I'm the
Yeah,
one.
I do.
We handle it.
That's good to hear. That's very
So
good.
if you're not handling it,
Yes, you do.
thank you. So, anybody, if you have a problem, if I don't know about it, I'm thinking everything's
She
going
can't
great.
fix it.
If I know it's a
Right.
problem, then it gets handled.
Okay, all right, I'll contact you.
Yes.
Yep.
I have something on a spiritual note. This gentleman touched my heart. We are our brother's keeper, and we are to look out after each other. And I think this organization is doing that. Since I've been coming here, I've been feeling like, you know, we lost a family, and I'm very interested in, I mentioned earlier about young people because what this gentleman said, there's a lot of young people out there that are struggling from broken homes, family that really ignore them, and then they grow up and have all these problems. So I think a group like this can help prevent a lot of that. And we work together and look out for each other. I think we've got a big chance to recover.
I couldn't agree more, thank you.
Lauren, if I could just add one thing to that too, and to the FAM community too, is that one of the things that I do is I ask constantly for the clients to speak up, and they're not even clients to me. They're, you know, they're part of my groups. They're part of my fellowship, and because their voices are incredible. They really are. These people, you know, they have a story behind them and stuff. And I always hope that we could talk FAN, we could talk, you know, some of the other people into allowing them as, because I almost thought tonight that instead of me sitting up here, I would rather some of the people that I work with sitting up here to tell the story. And because if anybody can tell a story about a peer recovery coach, it's one of them that's worked with me. You know, it's one of them that's had to sit through one of my groups and think, oh my God, I gotta sit here for another Sunday, oh geez. And by the end of it, we're having fun, we're laughing, we're enjoying, or we're crying because the subject was, you know, that touching, to get through it. So if ever in the future, the voices, as you said, the voices of the people that and, you know, I think the families are another one too, that you people need to speak up. You know, what are your struggles?
Starting next month, we're going to be doing what we've done the past couple of years, starting sort of a survey process, because we have to start organizing our forum schedule for next year. So we do want input from everybody that attends as in terms of what particular topics would you like to hear about. And so Tim, you just mentioned one. But yeah, we're going to have a survey forum on the table the next meetings from October, November, December to try to start organizing what we're going to be doing next time. Yes.
If we have a specific question for a specific person that the next, whole group doesn't need to hear, is there maybe like 3 minutes when it's wrapped that we could approach somebody?
I think so.
Yeah, absolutely.
Okay,
Yes.
thank you.
Ms. Owens, I would like to address what the judge said. Having both of my children being addicts, my son has called this number 1,000 times. He's been in QBH, Harbor House, a million. He was in and out of rehab. Well, whenever he called the number, it seemed like he always had to wait a day or two. There wasn't enough beds for this residential. I know you say you have none, but I've watched him wait. A lot of times worrying if he was gonna get a bad pack and not make it through.
When was that? Give me the time frame when this happened, because right now we have.
Well, he passed away 2 years ago, so this was 2 years ago.
Because right now we have 22 residential facilities.
Well, my
We do
daughter,
not have a wait list.
my daughter went all the way to Memphis, Michigan to go to Sacred Heart,
Right.
and they gave her bed away by the time she got there and had to come all the way back. And that's just not next door.
Yes, but guess what? Now you know who to call now, and I can give you my email address, and you can email me at any time, and that will be taken care of. Because trust me, I have to monitor the beds and make sure for SUD that we have it. We opened up a new facility with Quality Behavioral Health that has, I think, 100 and something beds, and it's a beautiful facility that he
I know
had
the
renovated.
owner, the.
Right, the VJ. But, this is a new one that he had renovated, it's gorgeous, we opened up, a couple of more positive images, so trust me, I have the bed available, so if you're having any problems, my email address, you can write this down.
Okay.
Is D for Darlene, Owens, OWENS, at DWMHA.com. Put in the subject line, what's going on, so that way it can pop up to me and I'll address it. Okay?
Thank you.
And if for any reason, because she is one person, if for any reason it's not happening fast enough, you can also access Hope Not Handcuffs, because they also have a direct line to her program and other people there. And you can do that, and you can do that online as well, so through the Family Against Narcotics. Yes.
When the judge said, you know, that sometimes that's not all, there's not always enough beds.
And I will say, when we've had people walk into the police station in the downriver area, and if I can't get them placed from a clinician, I send her a message, and within 45 minutes, they're off to treatment. So she.
I'll definitely be sending you an email.
Well, if
My
not, you
daughter
can
can't
contact
get
this
it.
beautiful young lady. And she'll call me 12 o'clock at night, like a family, so trust me.
Yeah,
So that's
for sure.
But that is something that we've heard a lot of complaints about our access center, so we are looking into that and we're addressing it. So don't think that it's
Yes.
not being addressed, because trust me, we are on it.
I think the issue is the screening, not the bed. Like that gets confused. It's like you have to get the screening done before you get the beds there, our beds. But yeah, sometimes, and I've emailed people as well. Darlene gave me, not her email, but, I already have it memorized, but, there are other people that in my line, for my program, that I email when I say, okay, I'm at this hospital, this person is being discharged.
We have the
This is the
supervisor
situation.
access.
Yes, so there is a chain for each program, I tell the client, like, I may or may not be able to grease the wheels a little bit for you, I don't promise nothing, but you still have to get screened by a professional before we can just take you into treatment. And, once we get past that screening process, then, all the beds and all the other services open up.
Because I have providers every Friday that lets me know their capacity, and then some of them are saying, we got all these beds available, how come we're not getting them? Because other folks are getting the clients, because they wanna go here, because somebody else may give us a box on, it's a smooth ride, and, and detox or what have you, so it varies, but we do have beds available, there is no wait list in the substance abuse, I can guarantee that. Now, access is having problems, but that's something that we're addressing.
All right, so I'd say that concludes our program, 8:26, and I know some of you maybe want to attack these people afterwards to ask some questions. So I want to give a round of applause